Look at COVID-19 in Asia, where differing approaches to the pandemic are on full display. China is still following a strict zero COVID policy of trying to eliminate every case before it spreads, while countries like South Korea are working to reopen and return to some semblance of normalcy. It's our second report in the ABC News Live series, One World, One Pandemic, where we look at the latest battles against COVID across the globe. Here's ABC's Maggie Rulli.
This is what a crackdown on COVID-19 looks like in China. For the country where coronavirus first ran rampant, even one case is too many.
Mass testing, aggressive contact tracing, restrictions on people's movements, including like the mass lockdown measures. The purpose of all these measures is to reset the cases back to zero.
China has relentlessly pursued a zero COVID policy since early on in the pandemic. And while China's southern neighbors, Indonesia and India, struggled with deadly COVID waves, including from the Delta variant, China essentially closed itself off from the rest of the world, striving to eliminate COVID within its borders. In just the past 2 weeks, authorities in China rapidly locking down and testing an entire city on its border with Russia, when just 3 cases were reported. That's now grown to 300. Last month, shutting down Shanghai Disneyland to test nearly 34,000 people after one visitor tested positive the day before. And the country will be enforcing a strict testing and isolation regime for all athletes arriving for the 2022 Winter Olympics in Beijing.
So the fact that they're not opening up when they're 80% vaccinated with their own vaccine, does that suggest they don't have much confidence in their own vaccine, you think?
If you talk about the zero tolerance, you cannot tolerate even one single infection. And even the best vaccines cannot eradicate the virus.
Today, China claims they're confident they can snuff out an outbreak in less than 2 weeks. And so far, unlike Europe, they've been able to contain the highly contagious Delta variant. This despite the use of Chinese vaccines whose efficacy rates have been questioned.
Does zero COVID work? Does it save lives?
There is no doubt, that the strategy has indeed worked in terms of sustaining extremely low level of infection and also saved, lives in the country.
Zero COVID comes at a cost, especially in places like Hong Kong, which relies on international businesses and travelers.
One of the busiest airports in the world, a ghost town.
Earlier this fall, ABC's Britt Clennett, who's based in Hong Kong, traveled home to Australia, which had strived for zero COVID until very recently. This was the first time she was able to hug her mom in more than 2 years. Returning to Hong Kong, she rushed back before local authorities imposed a 21-day quarantine on most international arrivals.
Because of Omicron, it's a race against the clock on this flight to get back before that midnight deadline. 21 days hotel quarantine.
And after all of that, she still needs to settle in for a 14-day strict quarantine.
Don't leave your hotel room until 15th of December. Otherwise, you will be prosecuted.
While China is still driving a hard line, some former zero COVID countries in the region are making the transition to living with COVID as they reach high vaccination rates. South Korea began this delicate transition in November. With nearly 80% vaccinated compared to less than 60% in America, the country felt it was safe enough to begin to open up, but slowly.
So everything's pretty much open for now, but private gatherings are limited to 6 people, and the only time I can take my mask off is when I'm having a meal.
ABC's Joo-hee Cho has been on the ground for us in South Korea throughout the pandemic.
Here in South Korea, the government switched to living with COVID policies, and everywhere you go, you have to take your temperature. And also, there's this QR code where you check yourself in, and this is all wired into a national system where the government could track down where you've been and whether you've been vaccinated.
She finds that most people she spoke with say they're fine living in this transition with a balance of freedom and rules. This man says that without a mask, you can't live your daily life. There's no choice but to wear a mask for himself and for others. Something this student from America agrees with.
I feel safer here than I would in the U.S. because people are wearing masks.
But for other countries in Asia, the battle against COVID still rages. Manila, the capital of the Philippines, had one of the world's longest lockdowns, yet it struggled to contain the virus despite crackdowns. After another devastating wave due to Delta, The country's now opening up with a total vaccination rate of under 36%. Their first Christmas in 2 years in a country that relishes the holiday.
Merry Christmas! Last year was a very sad Christmas. I think this time we're hopeful that things will go better now.
Many restaurants that sat empty for more than a year in Manila are finally reopening.
Well, we're very happy right now. Since a lot of people now are vaccinated, they can go out freely and they're not really that fearful of the COVID, so they're coming out of their houses already.
Hopeful business owners that are already fearing what Omicron might bring.
Omicron? That's our greatest fear. If people are not going out, what's the purpose of a restaurant?
South Korea is already reimposing some restrictions, but is still staying relatively open. China is using the global spread of this new variant to make the case that their methods, while harsh, have a track record of success.
They are actually using other countries' response, including the travel bans, to claim the superiority of its pandemic response model. To many Chinese, had it not been for the stringent pandemic control measures like zero COVID strategy, the result would have been disastrous, for China.
For China, the only way out may be the slow evolution of COVID into something as mild as the common cold. The country's top medical experts saying that China can only return to normalcy when COVID-19 fatality rates drop significantly.
Given this still overwhelming public support to zero tolerance, it might still be possible for them to continue that approach for 1 or 2, if not 3 years.
Potentially very long road still ahead. Maggie Rulli, ABC News, London.
Our thanks to Maggie for that, and be sure to tune in to COVID-19 One World, One Pandemic on Friday at 8 p.m. Eastern right here on ABC News Live.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.